A very good morning to all of you. Welcome to the CPD webinar series organized by Society for Health Research and Innovation. First, let me introduce you with the housekeeping rules. The webinar link will be available from 9 a.m. to 9:50 a.m. to you to join in. No late attendees will be entertained thereafter. Each attendee should have been attended till the end of the webinar to obtain the certificate for CPD points, and the CPD points are strictly adhered to the NCCPD guidelines. These are to improve and maintain the standards of the CPD programs conducted by Shri, and thank you in advance for your strict adherence. You can ask questions at the end of the webinar, and if you have a question, you can type it in the chat function, and if you have very specific questions, you can email us on officeshri13@gmail.com. So today's topic is Doctor's Role in Educational Underachievement in Children. The guest speaker for today is Dr. Anuruddha Padeniya, Consultant Pediatric Neurologist, Lady Ridgeway Hospital for Children, Colombo. Dr. Anuruddha Padeniya is a Consultant Pediatric Neurologist in Sri Lanka, currently working in LRH. In addition to his clinical obligations, as a professional and as an activist, mainly in policy development, he has extended his leadership beyond his discipline to the field of healthcare in general. So as we all know, acting as a trade union leader of the Government Medical Officers Association, he has made historical achievements for the welfare of the membership and was appointed as the president of GMA consecutively for 10 years. He was honored with prestigious Eisenhower Fellowship in 2012 in recognition of his outstanding leadership shown in the field of health and other sectors. Over to you, Dr. Padeniya.
Good morning to all of you all. Today, we are going to discuss a very important topic, that is the doctor's role in educational underachievement. So, we will start the lecture. Basically, what we are going to touch is currently doctors are of the opinion that education underachievement is completely in the sphere of education, that doctors have nothing got to do with regard to educational underachievement. So I think this may be a novel topic for most of you all listening here as physicians, maybe in the capacities of general practice, or maybe in the pediatric field or in the psychiatric field or whatever. It's very important that our role as a physician in the education underachievement is brought in with clarity and the available evidence all around, and then the good practices which are followed in the world to be touched upon for us to understand this concept and to appropriately contribute to this very important endeavor. So the first important point what I have to tell is every child is different. They have come to the world to contribute to the world in a different capacity. So trying to put them in the same track might create trouble, not only for us, those individuals, also for the society. And this difference is basically evolves around their strengths. At the same time, rather than calling them weaknesses, the challenges that they face during their life events. So at the very beginning, they go through a process of education, but it's a lifelong process, but mainly in the process of education at the very beginning. So in that process, if this matter is not appropriately dealt with, how that is going to have impact, and in that context, what is our role as doctors. So you can see in this picture, some are disturbed when they are supposed to do their education. At the same time, some are really creative and looking forward for their dreams through education. So both the extremes with the spectrum of children we will encounter in this process. So having said that, what we have to tell is the usual understanding is if you underachieve in their education, the feeling is that you will be badly reflected on the society and you will have a bad future. But you can see the other side. It's a blessing in disguise in certain aspect. You can see all these international figures in various spheres. Albert Einstein from the scientific field and going down to Richard Benson, Richard Benson is a wonderful entrepreneur in America, and he is one of the leading people who are claiming on his dyslexic situation, and basically all these people are dyslexic. But however it is, they have won the world from different angles. Actually, this Richard Benson and them, you can see a lot of videos on the web, how he was dropped out from the school and how he was insulted in the school because he couldn't read properly because he's severely dyslexic, and how he is managing day-to-day affairs at the moment, and he's the owner of the Virgin Air Travel, and he's one of the top entrepreneurs in USA. And also he is talking the benefits of dyslexia, and when he's going to recruit people to his institutions, he has a more predilection to dyslexic because he claims that the dyslexics, as reflected on the science also, they are very creative, they are very communicative, because since they can't read, they have to have the communications with verbal communication, so their skills are very high. They look in a very broad manner, and they solve problems in a very scientific or maybe very innovative approaches are there. So with all these things, having dyslexia is a blessing in disguise to a certain extent. So with this spectrum,
Excuse
where
me, sir.
dyslexia is considered as a weakness from one end and the other end, it is
Excuse me, sir.
kind of a strength from their potential at the end of the day. So with all these things in mind, we will see how as doctors should perceive and how we should contribute to this academic underachievement. The lecture will cover a basic concept of still evolving definition of educational underachievement, or some people call it academic underachievement. Still the definition is evolving. We'll see how it is evolving and what are the concepts which are shared in the academic field, in the education and health, both with regard to the educational underachievement. The second aspect is I'm going to just touch the impact of it, the education underachievement, and then we are going to mainly touch the role of a physician. In general, we will touch and then we will see individual roles in time. And I have just listed a couple of slides on the basic facts about specific learning disorders, but that is not the main aim of the today's scope of the lecture. We'll see the definition. What is academic underachievement? Now, what we see is when they score low at the school, and say suppose if they are having 30 marks or 20 marks, 10 marks, less than 30, less than 35, in certain definitions of various schools and various settings, they might say you are academically underachieving. Actually, what we see in the school work is a low performances. So that may be due to two categories of people. One is they may be low achievers altogether, or they may be high potential people who are, for other reasons, reflecting low achievement. So both these categories will be there in this process. In the definition and the new approach to measuring academic underachievement is being debated all around from various angles in the research, in the education as well as in the medical or the health field. They use two words, the gifted children, and you can see in the slide also non-gifted children. I don't know whether that is a correct word to use, and this had been traditionally driven word because when you have a very high IQ, and there is a category called gifted child, and as I told you in the very beginning, when you are dyslexic also, that may be of a gift to some extent from one angle. I told you there are low achievers as well as high potential people who are scoring low achievement at the school. So with all these things in the practical definition comes through this process actually. So to understand whether you are a real low achiever or where a high academic potential is reflecting low achievement in their school work, then again we have to see why it had happened. So this is where we are heading. And all in all, what I want to tell is both gifted and non-gifted learners can underachieve. That's the most important thing. And so therefore, in the process of work or in the operation, they consider, define as failure to meet the academic requirements of the school setting or the general setting for you to see advanced level, A levels, all these exams are in the national way. And when they can't score to a level that it is expected, then you consider that under the category of underachievement, but you have both these categories. So then again, you have to see this process of evaluation is fair. So what is the fairness of this definition of academic underachievement if you are going to use that? Currently, it is defined as failure to meet the academic requirements of the school setting or for the national. But you can see this is a nice cartoon I used here. For a fair selection, everybody has to take the same exam. Please climb that tree. So actually, when you see, when you have different potentials, different routines, and ultimately when you are given the same task to perform, and based on that task, when you are going to consider you are underachieved or overachieved or reasonably achieved, is a question in place in fundamental principles. We will listen to Bruce Safiro. He is the professor of pediatrics at the Johns Hopkins Hospital, who had published a lot of review articles on this topic, what is academic underachievement. And according to his latest article in 2024, he is highlighting various very important facts. You can see academic underachievement is going up to 13%. So therefore, if you extrapolate it, every seventh pupil will have to be dealt with regard to the academic underachievement. And very importantly, the academic underachievement has been associated with social, economic, and vocational outcomes. So this is very important. This is not, you can't just think about that the academic underachievement is an individual issue and let that person look after that. But it's more than that, and it has impacts on the social, economic, and vocational outcomes, and in that way, it has national impact. And there is no universal definition at the moment to date, 2024. And the diagnosis of academic underachievement, when it is differentiated with the other diagnosis, it will be fairly broad. Another important thing is the interventions or the treatment, we would say from our language, is multimodal. What is the education role to play, social aspect to play, and the medical aspect what we are going to play will differ. And there obviously it is very important that what aspect that we are going to cover and how we are going to collaborate, how we are going to integrate is a real process that you need to understand. And failed programs are often over. So if you fail to do so, they define it as production inefficiency, because whoever who comes, you have to treat them to get the best out of their abilities to the society. So they have analyzed fairly a high number of children from 168 schools, and it's over more than 6 years. And they say the gifted children, and they define the gifted children as high IQ in the top 10 or top 10%. And they claim that they also underachieve as much as other children. So therefore, what we can see is low achievers reflect anyway the kind of school definition of underachievement. At the same time, gifted children and the middle level children all are showing underachievement. So it's a universal problem in the school education rather than considering that it's a problem of low achievers. And they have analyzed another point here through their other limbs. They have categorized the classes less than 20 pupils, around 20 pupils, and more than 20 pupils. And they claim the best outcomes they have recorded when the class size is of 20 pupils. So that's a political topic in this context. So that had to be taken with the other facilities and other requirements altogether. But their point, what they raise is when you are going to help underachievers, the size that is most optimum, that according to their research is 20 pupils in a class. So impact of underachievement, people claim that it's an individual issue, and if you don't underachieve, then you will go to hell, like that kind of attitude is maintained, because there are limited career opportunities had been recorded in the scientific field, and the very important point is they will have reduced self-esteem. That is a very important point I will highlight again and again. that when a child is reflecting underachievement, it's very important that you safeguard his self-esteem. And the increased risk of dropouts, as I told you, and mental health challenges and social exclusions are sometimes the secondary complications of it. So it's very important that you learn to handle without letting them fall down to the this category, and especially when their self-esteem is being destroyed, they will be kind of taking revenge from the society, and that will be a real challenge to handle from that aspect. So it's very important that we, from the forefront, we handle the academic underachievement, not letting it to have a impact on the individual. As I told you, the societal impacts, the society will have impact, the higher crime rates, and this is a very important topic beyond today, but we have to study and the social inequality, and it will have a generation cycles when you have academic underachievements in the society. The economically, as I told you, academic underachievement is not identified problem for only for a unique category. It's a universal problem. So what will happen is it will have a low productivity, and it will have economic impact, and not only from the financial, also in the production line, the skills gaps and their potentials, because the world is built up. When you are going to do something, various skills had to come together, from starting from the high ranking architectural skills downward. When you are designing a plan, you have architectural or design, even economical architectures from down the line, implementers, and then so middle and lower level. So all this structure had to be maintained in order to have a better economic input to the country. So that might have education burden also. Teachers burnout might be a problem, because all the, whether they are academic low achievers or high achievers together, and the class sizes I told you is not optimum. So all these things will have strains or the burnouts on the teachers as well as on the school, and the funding and other resource allocators or the policy makers will have issues with regard to this. At the same time, it will have a community impact. It will have the civic engagement, and to have reduced quality of life. So then, straight away now coming to the doctor's role. Now I have given you an understanding by the current evolution of the definition of academic underachievement, and then its impact, and it's so we can't deny, because the doctors are supposed to be the ambassadors of the society, especially the poor, everybody alike. So therefore, you should know how you should proceed in this very important endeavor. So we'll see what our scheme recently, this is one of my publications recently, we highlighted the parental approach, parents approach doctors when the children underachieve in their education. It's a family matter. So family physicians will have a major role to play. In handling such situations, physicians need competency. This is what I am trying to touch today, at least to give you awareness that you need competency. Such competency has several elements. First thing is the confirmation of academic underachievement. Second thing is proper evaluation to seek medical, family and social and other type of causes to it. Thirdly, making appropriate referrals to reach the diagnosis. It's complex because it's not only within the health categories, it will be beyond. Then you have to collaborate with the education sector. You have to write letters. Those letters have authoritative impact. It will have a legal impact to the relevant establishment, which may be new to you, and you may be not familiar with the legal and other kind of enactments which are in place at the moment. Then how we are going to direct as a clinician to individual parents and to the child, especially when the child is adolescent, when they themselves will come and ask your help, to the appropriate resources for their benefit. So therefore, it's very important for us to learn from the good practices. UK, you have the SEN, that is Special Educational Needs Platform. Then USA, you have the IDEA Act. So we'll touch that in the process. Very importantly, I would like to just tell you simply about the dyslexia, dysgraphia, and dyscalculia, just for you to be aware what they are. So you can see specific learning disabilities. I told you it's 1 in 7 kids. You can see specific learning disabilities, the family physician's role has been highlighted by the American Family Physicians Association right from the beginning. And if you read this abstract itself, you will understand that your abilities will have to cover a lot of aspects as I told you earlier. So that's been what I told in my uh, publication is backed by this article as well. Why doctors are going to help people to get themselves educated, or how we are going to help this academic underachievement and how that is going to help the health? Because when they have low education, I will show you in time, they will have low income. So when the low income is there, from the public health point of view, curative health point of view, that we will have challenges in managing their health status. At the same time, education straight away has a health impact. When they are undereducated from the scientific background, you can see this publication to show that it will have impact on health anyway. So various angles are being used to connect the impact of education on the health, and especially as health providers, doctors will have challenging situations unless you handle that education aspect of a country immediately as well as intermediate and long term consequences. So here, this is article in the pediatrician's role on the school performances. You can see that I have summarized here reasons why parents are so concerned in USA with regard to education. You can see this article very nicely show if you are not in high school, your salaries are very low, and unemployment rate is also very high. So it inversely correlates with unemployment, and it correlates with the salary. And you are a professional, you can see you will be much benefited when you complete your education. So this article concludes to say that no wonder why parents are trying to educate their children. When you see this graph, obviously it's a investment for themselves as well as to the child. So with that sense, this article very nicely in the abstract itself says doctor is the child's advocate. So therefore you have a very important role to play. When the adolescent is there, they themselves might come to you, and otherwise they will come through their parents, or maybe directed by the teacher or the caregiver, and or extended family members when the child is not performing as expected by the school parameters. And neurologist obligation, why neurologists are getting involved. It's a very important, you can see it's a very significant effect on the individuals and the society, and difficult thinking, acquisition and processing. All these things are highlighted from a neurodevelopmental point of view. And it's very important that organizing additional care, education and medical services, when you are putting together, each will have these impacts from education. And very importantly, when you are going to handle neurological patients, even to take a proper history, to have a better historian, the education of the patient has an impact on. And the DSM-5 recently, you can see specific learning disorders are considered under neurodevelopment, and we will see why it is highlighted under neurodevelopment. Now, why neurologists are getting, because the neurologists are supposed to cover the brains and the other parts of the spinal and the other neurological systems. You can see, just to highlight, this is not to explain the dyslexia basic causes, but you can see how this reading is operating or happening with regard to the brain operation. Now, as you all know, you see from your eyes. Then the lights, though the eye is and the front of the face, it will be read by the occipital V1 section of the occipital lobe. So V1 section will not be able to, they will perceive what we have seen. Say like, I would use the example, you have seen the word country. Country. So when the country comes, now you have to see, decode it into C, what this CO like that the letters. So that part is somewhat anterior to the visual cortex, and that will be connected from the visual cortex to recognize these symbols. So the symbol had to be taught beforehand, and brain is actually in the evolutionary process. When you read, they are all the instruction they expected through hearing, but this is the reading started later on, and then again when the symbols were developed, and all these symbols were recorded into the brain, and now we kind of match with that symbol, and we realize now this is the letter C. So that happens not in the visual cortex, it's anterior to the visual cortex. And not to complicate, I will not give the real words to all these areas, but just to highlight the concept behind that. Then once you realize C, O, U, and the rest of the country words, then it had to be, it will go up here and learn to phonetics, or the how you are going to sound it will come. Then you have to have the country meaning. Now, when the country word is listened by you or me, we will see Sri Lankan flag or Sri Lankan map, or that will come to our mind. But if Donald Trump is going to see that country word, he will not get the Sri Lankan map into his head. He will have American flag or American symbols into his head. So similarly, the way you can see the vision is somewhere recognized in the country, these letters are from somewhere else, then the phonetics come somewhere else, then the understanding will come somewhere else, then based on that country word, how you are going to evolve your thinking and others are somewhere. So at least you can see there are, when you are reading, your brain, at least 5 or 6 areas are in function. So if the neural connections are not up to the mark it is expected or optimized, then of course you will have reading issues. That is why it has been classified as a neurodevelopmental issue, and especially when you meet with an accident, and or else when you have hypoglycemia and occipital cortex is have some damages or hypoxic damages, all these things will lead to problems in reading, and that is being tagged as dyslexia. And similarly in the brain, the dysgraphia, dyscalculia, all these aspects are being nearly wired and connected in appropriate manner for you to fast read. So in summary, what we have to tell is that healthcare provider has a multiple roles to play in the prevention, detection, the diagnosis or management of academic underachievement, and it been again and again highlighted by the professor of pediatrics at Johns Hopkins Hospital in his recent article as well. So academic underachievement, now you clearly agree that it's a very complex task that doctor has to play. Then again, I told you, when you are treating patients, we are dealing medical conditions, we have the patient and then yourself. Now in the pediatric practice, I think we have a triangle. You have the patient, you have the mother or the caregiver, and then you are on the other end. Now, when a patient comes to you, usually what happens is we sort out our problems. We don't look into what the child wants, what the mother wants. So ideally, if we are developing a care plan, we have to bring them also on board. Otherwise, we may be doing our best, but it may not be reflected as it is on the context of the child and the mother. So to bring, you have to understand the mother, you have to understand the child, especially when the child is even younger child. You have to understand the child, and then you have to come to the middle and give the care. So the same principle, so that's why I always use the, rather than the treatment or management plan, we have to say the care plan. So this care plan principle, when you apply it to the academic underachievement, how you are going to place yourself. And in this context, actually, it's further complex because you are supposed to entertain a lot of others. Now here, parent, the child, you can't drop at all. You have to be, he should be in the middle actually. But you are dealing with psychologists, educational psychologists, clinical psychologists, and various other uh, uh, so-called experts in the educational field and in the paramedical fields are on board. Very importantly, whatever you have, will not be a success unless you have a good connection to the resources. So resources may not be in these expertise sometimes, and they may be funding agencies, they may be providing various resources for the best interest of dealing with the academic underachievement, then the policymakers, so and the social service workers. So all these contexts, so therefore it's very important that when we are going to deal with the academic underachievement, that all these players are in place and you are supposed to handle. It's like it's beyond actually public health like. So all these players will have to be optimized in your process. So having said all these things, what we did was we published recently an article highlighting to simplify, or I would say to organize or methodologically organize the doctor's role, how they are going to play. So we highlighted with the evidence and the good practices under 5 categories. So I would say these are the 5 steps that a physician can play with regard to academic underachievement. So the first thing is, first of all, you should be able to confirm the parent claim. Ideally, this work had to be when the patient comes to, the child comes to you, you should be able to detect it before even bringing a claim by a parent. So I would say it's the detection and confirmation of the parent's claim as number one. Number two is you should know how to properly evaluate in your hands the medical aspects, and you are the family physician or maybe a pediatrician who is dealing with the family, and how you are going to see whether it is a element of family element which causes the underachievement or whether there's a social element or any other cause. Once you do that, if you have eliminated the family, social and other causes and the medical causes, and if you purely think that it is a educational difficulty, then you have to properly diagnose to the complete as much as possible to a specific learning disorder rather than calling this child can't learn. Then once you do that, next step is that you need to collaborate with the education and other relevant stakeholders in order to for the best interest of the child. At the same time, it's your duty to direct and guide the parents for necessary resources available in the vicinity. So the first step, how we are going to detect, then how we are going to verify a claim by a parent or a teacher that this child is performing not expected to the status. So what are the good practices? And when the process, what are the legal frameworks in place, and what are the tools that you are going to do? I will not be able to touch all the tools, all the good practices. This is just to give you the concept that when you are going to do, there's a process to follow. Now, how we are going to detect as a physician? Now, if you are a very clever physician who can detect the academic underachievement, is wonderful. So to do that, these are some elements that you will be able to use. Number one of the developmental screen. Actually, when you are going to do the developmental screen, you have in our principles, we have the gross motor, fine motor, and then we call it speech and that aspect. I usually, as from a practical point, we see the gross motor is basically brain, different aspect is covering up gross motor. Fine motor, then the cognitive aspect is basically covered by speech. So the earliest sign of cognitive or intellectual abilities are being detected by the speech. If there is a speech delay, it's very important. Actually, fine motor comes in between. If you put two circles, it may be mixed up together. So gross motor, fine motor, and the speech had to be taken from that perspective. So the speech is the first teller to us on their cognitive or intellectual abilities and their potentials as well as the other end. So that's a very important thing. With that perspective, that you have to look into the developmental milestones and the development, not only the milestones, it's only the quantitative part, and the qualitative aspects of the development will have to be visited. Even the speech, whether they are expressive speech, receptive speech, these aspects have to be dealt with from the developmental angle. The second thing is there is a PET screen test, and I will go into bit detail in time. There are 8 specific areas being touched, not actually 8, they call it 8 specific, but it's so only 7 specific areas on that PET screening tool that can be used in the game. Then the school readiness tool. Now you can see the currently used school readiness tool is touching the IBE, that is the intelligence, behavior and education. Now in the process of epilepsy management also, you have 5 axis management of epilepsy. The 5th axis is actually IBE, that is when the epileptic child, whether that child's intelligence, behavior and education, or whether that is associated with the epilepsy, or whether our treatment or our interventions are affecting IBE, intelligence, behavior and education, had to be dealt with. Actually, I got this interest of studying this academic underachievement because of this epilepsy, leading us on their 5th axis to deal with intelligence, behavior and education. That's why we started our clinic way back in 2012 at the Lady Ridgeway Hospital to detect these things, to just to serve the requirements of the International League Against Epilepsy requirements of epilepsy, and that is the complete diagnosis. That is how we got in all. So the school readiness tool also touched to cover that. But in addition to that, they see whether the child is toilet trained, whether the child can dress himself, and whether the child is able to be away from the parents. So these aspects have been school readiness tool is covering. Then the basic likes. They are not academic knowledge is what is tested in our context in this Sri Lanka. It's wrong. Actually, what they are aiming mainly towards whether the child can have the basic idea of the colors, numbers, and letters is enough when they are going to start the school. And more than that, I told you, other aspects are very important. Then detection, now in the process of detection, all these places you can visit and see whether there had been a problem. Then the school performance can be inquired. You can write a letter to the teachers and can bring down the school record sheets and you can see during your consultation. And also then you come to when the parents themselves present that the child is not properly doing good at school, then how you are going to do. At the same time, you may be requested by the school teacher or directed by. So the plates just to touch in brief what are the aspects that is going to cover. You can see it's an evidence-based method of detecting or addressing developmental behavior and social, emotional and mental health of the children. And it's a kind of a scientific tool and it's you have to pay some money to run that show and basically going to touch not only the weaknesses, also the strength of a patient. And it is beyond the developmental sphere, touching the various other aspects as well. You can Google and see this tool. Also, this is a screening tool to some extent. It's not a diagnostic tool. You can't, you can only direct, make appropriate referrals to diagnose. It's kind of a screening tool, can be used in masses in general. And it's a secondary tool that may also be used for the part of the evaluation. You can see this is the kind of platform they use and they not only evaluate, they categorize or scale it up their difficulties or gaps in their abilities. And then these are the 7 aspects I could see, but they in the 7 domains, but they claim it that there are 8 domains I couldn't find. I could only find these 7 domains: expressive and receptive language, then the fine motor I told you earlier, and the gross motor, and the school skills, you call it the scholastic abilities, and then you come to the cognitive and then any other health concern. You might have seen in the private schools and them, they may be sending letters to you all to see whether the child's health, whether there's any health concern before they start the school. Actually, that is part of the elementary aspects of seeing whether they are school readiness. And at the same time, you can see it's not only the physical health, but the mental health, emotional behavior. I don't know whether we have skills to see the emotional and behavioral skills from our perspective during the training, basic training. And then you have to categorize and scale it up. And then whether there are family and social challenges, whether the child is facing, also should have to be bring under the screening tool. So this is how they report it. And you have to fill, there's a process to follow and you are accountable for that. So you can't just fill it, you have to get the PREDS training before you train it, before you fill it. And basically it's I would say that actually bringing standards into our practices. We call it SOPs, standard operating procedures, and that actually will make ourselves easy and much more your colleagues, or for the research purposes, you can compare your roles with the others and in the colleges can take this up. And another tool is MChat. Of course, you may be familiar than the pledge, and they actually categorize into low, medium, and high risk depending on a score. And by bringing a lot of aspects of their capabilities into hand, this is how it is being filled in the practical setting. Then the school readiness, you can see the colors, letters, numbers, and the sizes comparison of the subsets, then the shapes, self and awareness. All these things are brought in the school readiness tool, and ultimately you score it going up to some level of qualitative analysis source and give a mark and then you total it up and you send a report. So you can see the process is governed very trained governance is there. So it's informed comment, informed decisions, informed reporting that we are doing. Right. The next step is the verification of a claim by a parent. So what are the methods that the good practices use to verify? You might arbitrarily say that I will be able to verify, I can check and all, but you have to have science behind it. So nomination method is a very crude method where you ask from various categories. Actually, it is better than you are just asking from one or two people, and it's a kind of a 360-degree method, listening to parents, teachers, extended family members, peers, all these things to bring a kind of a decision at the end based on their feedbacks. Then there is another way that they have tried the pupils aptitude test score. Whether they are suitable to do aptitude at what stage, whether at the age of 5 or 6 or 7, or that's another point that you need to analyze. So whatever method that you need to verify and see whether we are in the wrong analysis or evaluation or not. Now parents come and say, she can't pay attention. Her memory was not good. She's very slow. Compared to my other kids, she's not behind or she's better off. Her grades are terrible. So these are some comments the parents might come and tell you, or maybe the teachers would have reported down to you. No, then our practice is that we start from the presenting complaint, that is filed from the medical schools, and as an intern we learned history of presenting complaint. So how we are going to put to our the same model that we are trained so far, how we are going to handle. So first of all, you have to see whether it is a current event or it had been persisting for a while. Whether it's a subject specific problem, whether it's a maths is poor, others are good, or reading stuff is bad, the rest of the things are good. Within the maths also, maths are good, but the maths with a lot of words and all, text, then child is struggling. So when the dyslexic child can't read that, he can't do the maths. But if you are given a straightforward addition subtraction, if you don't have dyscalculia, the fellow will do that. So that had to be verified. Then you have to see the school attendance, whether we have given the adequate opportunities. Then what is the behavior at the school had to be visited. I'm just touching fast. And the past and present medical history, whether you had asthma. Asthma has, I am not going to go into details, but a very high impact on the academic underachievement. If I remember correct, it's somewhere around 20% of underachievements have been accounted to this. And epilepsy from various angles, whether the epilepsy itself or the medications. And phenobarbital and benzoxine, and already highlighted, they have a cognitive impact. Valproate, carbamazepine, and phenytoin has reported that it can slow the process of learning and it might have academic underachievement. So maybe high potential child may be going down because of these drugs. So you have to be careful. And antihistamines have been very widely used, so that has a sedative effect. So rather than they have any other specific learning disorders, they will not be able to concentrate because they are sleepy all the time. And then the family history, very importantly, and I will go into the family history in time. And examination, we have to see the higher functions, behavior, vision, hearing are very important, vision and hearing. That is within your scope that you will be able to ensure and see your vision and hearing are good. Then very importantly, that as a family physician or a pediatrician, it's your job to see how the assessment of a home sleep, very important, whether how the screens are being placed at home and the screen time, and the quality of sleep and the inconsistencies in the bed times. All these things actually there are figures. I didn't not to complicate the slides. I dropped it, but you have percentages in this evidence. Each factor how far it is going to contribute to this each element, and especially the sleep respiratory disorders. Of course, the morning time will have daytime somnolence, and those kids will underperform in the morning than the afternoon, especially the media use in real touch at the moment, and that not only the media used screen time and the way they are using the screen, whether they are very close from the eye surgeons, they have raised their concerns. You can see British uh, Ophthalmologists Association, they are talking about a 20-20-20 rule with regard to the impact on the eyes, and then the content of the what is delivered through the screen is very important, that is going to have more damage. So not only the quantitatively, it's qualitatively you are damaging. So there are principles brought by the American Academy of Pediatrician. You can go to their sites and see the parental tools that supervised parental screen time has much better a way of bringing down the academic underachievement because of impacts of the media use, and some kids are basically screen addicted. So, and especially the screen time during the school week has more impact over the weekend or vacation. So this kind of analysis had already done, that we will come up with this is not in the scope of this lecture, we will do it in another lecture. Each and every these component, how that is going to affect the academic underachievement. This is just to touch the areas that you need to know. So therefore, this is one of my publications. You can see they are in the Anuruddha grade 9 children, and and this is their own reporting, and it's fairly a big about 3,000 children. I interviewed in a by a questionnaire which was reported by them, and they claim that 26.6 hours per week, it's almost a full day in front of television, grade 9 students in Anuradhapura, of course. Then Colombo and other suburb territories had to be really visited, and I think it's time that the pediatricians put their inputs to the screen time and see, and I'm thankful some of our colleagues have already taken activities on and real raise concerns. I think just raising concerns is not enough, that we have to have a very develop a standard operating procedure on this regard, and I think that can run parallel to academic underachievement. So then again, the verification of the academic underachievement, you can think, as I told you, whether it's low marks or low performances, or whether there's a decline in the marks or performances, whether it is a comparison or competition, will have to be dealt with and see whether that claim is properly correct, and whether the it is stacked up with the high expectations of them, or whether it is a true academic underachievement, whether it is short term or long term, or whether we have given adequate time opportunities, and whether their evaluation is fair. Sometimes the question papers are very tough and they may not be touching the potential of the child, and it may be unfair, and the opportunities have to be given appropriately, and then all these things can be brought by you and raise it up with the necessary relevant people. So in when you see the good practices in America, what they used to call is RTI, that is a response to intervention. When there is a claim that the child is not academically proper performing, what they will do is they will see whether the child, there is a process to visit whether the child is really doing, and there is a tier system, and to see whether child needs ultimately individualized educational program, whether it is so verification, whether it is true, then whether you need individualized academic educational program. So these are some terms that is used in the IDEA Act, may be useful to you to see, to understand most of the activities. So they have RTI in that place. So through this IDEA Act, the IDEA means Individuals with Disabilities Education Act, which was ultimately amended in 2004. And under this IDEA Act, there are talking about the free appropriate public education as well as multi-tiered, whether they want special education and their responses. And you can see that they highlighted that it's a part of the GP's role to see these tiers are in place. So that is actually the first step of academic underachievement to verification. So there are good practices, and I will limit at that point and go to the second step. So second step, of course, basically in your hands, because just to see whether you are dealing with the courses, whether the medical, family or social. Now, how can we go through that process? So medically, of course, we have to see the family history, whether they are learning disabilities or special education and ADHD and other aspects are there. Each of these things carry certain percentages according to the evidence. I have dropped them just to touch the concept. And the antenatal history, then whether there are perinatal insults, all these things what I have listed here with evidence and which have an impact on the academic underachievement. Then otitis media has been highlighted very highly, and respiratory asthma. Obesity has various aspects contributing to academic underachievement. From indirectly also, when they have low so kind of esteem, and that obesity will have a low esteem, and then social relationship will be low, and that also will have the peer pressures and peer insults and other things. So various ways it will contribute, and those are actually topics themselves. I am just touching the areas that you need to cover. Then the genetic and other disorders, neurological, especially this neurofibromatosis, neurological disorders, and then other kinds of chronic diseases and traumatic brain injuries and other acquired injuries. And then developmental language and the visuals and hearing will have to be touched. Having said that, you can see in this list also, from a GP point of view, they highlight we have to have a SOP to see whether the family matters are appropriately recorded, and then the family history, then the medical and the social aspect. So these are tools that you can use. Then the common comorbidities are being listed, and each of these things will have their evidence and what impact and the impact factor we'll deal with in another lecture. I am just touching the 1, 2, 3, 4, 5 steps just for you to be aware that you have a process to follow, and each aspect we will discuss later in a separate lecture. So physical examination, of course, dermatologically, you have to see whether there are neurofibromatosis and that kind of capillary spots and that area. Then dysmorphism, you have to see facial dysmorphism, digital dysmorphism, and so on and so forth. And general neurological examination from top to bottom you have to do, and you have to see the growth and development and handwriting, the handedness, spellings, and you can give a sheet of paper for them to write, and you can have some idea about their lettering legibility, and then the sensorium. The family, when you are going to visit the family, these are the evidence that they have listed. Their social economic status will have to be visited. Parental involvement in education is very important, whether they are over-involved or under-involved. Home environment and their stress and the parents' behavior and the education attitude at home and the parent education level. These are the evidence-based analysis that they have done that has a great impact on the child's education and achievement. And these are the evidence you can see, and their publications with regard to all this aspect. Social, when you go to schools, we have the peer pressures, then the school environment, how it is been currently in Sri Lanka also, depending on the school environment, their performances vary, and the teachers' relationship with them, the class teachers and the others, and the sports teachers, various relationships, and the community expectations, and then the cultural expectations. All these things matters in the process of academic underachievement. So these are peer pressures and peer aspects have been highlighted, and development, and then so this, as I told you, from a socio-economic status, there are scales you can see depending on their abilities. We have to analyze it in a scientific manner, and these are family income, educational occupation. We have put to a score like this, and then go and see how well they are doing. Then the peer relationship, there's a scales, scientific scales developed that you can use them. So and this other expectations have been highlighted. There are SOPs developed with regard to analyze. So having said the second step, that the medical, family and the social aspect have been touched by us, now we come to the proper diagnosis. So if there are no medical issues, so if they have dealt with the medical issues, the family issues and the social issues appropriately. Now you can see the scope of you all is broadening and broadening in this game. And then you come to the specific diagnosis if you have eliminated all these things, whether you have a specific learning disorder. Now, in the IDEA Act, it is used to provide a variety of it's actually aiming at to misidentification. As you know, in America, everybody, everything evolves around kind of financial aspect being touched. So therefore, and the discrimination and other aspect are being eliminated. They are trying their level to eliminate. So most importantly, you can't overdiagnose or underdiagnose. So it's actually the misidentification is what they are aiming at for the resources. So in this process, it's provide variety of assessment. You can't go by one assessment. So the doctor's role will be checkmated from the other assessment. So it's very important that you do a proper job, and according to that, you will be able to defend yourself and accountable to whatever the reports and other things you produce. And you might have to go to the courts and defend yourself. So therefore, it's not a single evaluation. So therefore, you can't arbitrarily do. You have to do it in the process of individualized education as a team member of the individual education plan that you have to contribute in a scientific manner. And there are procedural safeguards also. SOPs are there when you are going to do, whether you are going to free education or special education, and when you are going to say special education, to what extent, what resources you are going to use, how you are going to line up the social services support. All these things depends on how you are going to evaluate. So therefore, there are procedural safeguard to so access to education and writing letters and understandable language from their angle, informed consent. All these things matters are very important in this process that you need to cover on the training of this academic underachievement. And then the child will have a safeguarding positions. They have various ways to complain against you, to administratively or to the legal system. So therefore, up to the litigation, there can be, you might be involved in the mediation. All these things had to be dealt with. So, and IDEA Act actually trying to cover or to put things in some order, and especially when these are with lot of stakeholders, how you are going to bring the flow chart is what matters in this exercise. So it's very complex task, but brought in some SOPs into it. So we have to when in the just to touch the individualized educational plan, that it will basically touch the current situation and how it had affected, and then how your services are being going to be aligned, and then how you are going to have your outcomes, so measurable outcomes annually, as well as how you are going to deal with the progress report. So these all aspects are being covered under the individualized educational plan. And then secondary goals, how what impact on their education in long run, training and employment and their career developments, and how we are going to have independent life. All these things being covered. Sharing our experience, which we started a decade ago, that this learning issue, and we have not gone up to the idea level. Actually, we are far behind. We have just touched a parental evaluation, and we are touching 7 elements: the buddhiya, හැසිරීම, අධ්‍යාපනය, then the attention, memory, dyslexia, dysgraphia, dyscalculia. These are the 7 elements that we are touching at the moment. And we have given a numerical call in a Likert scale of 5, and we asked the parents to fill this sheet. And so therefore, what we get number 7 numbers. So when we enter into our computer the 7 number, we can generate the paper back, and we give the this sheet of paper back to the parent for them to produce at any place. And then there we have the evaluation by teacher. Actually, the first chart is to capacity building them. We have given them because each teacher, each parent will feel as they wish with regard to the intelligence, behavior and all these things. So to make it much more data quality, to improve the data quality, we have given guidelines and certain kind of a tool for them in the process of evaluation. They will have to read it before they fill it, for them to bring some uniformity in their filling exercise. Then we have the professional evaluation. You can see we issue a report. Here you can see we through the memory, attention, and then the reading, then the writing, then their maths abilities and their listening skills, all these things scales, and in a Likert scale of 1 to 5 is being rated. So therefore, when they are improving, we can see whether they are moving their boxes from one box to the other, and it's very numerically, because then it's an understandable language for the professional as well as everybody, that where do they place, whether they are in the above board or above average or below average, and how below is been in this Likert scale. It's very informative. Recently, we developed this sheet to be handed over in a confidential manner. There you have brought in the parental evaluation, teacher's evaluation, and our evaluation together. So yeah, we call it a 360-degree evaluation of all these 7 elements at our clinic. So this is what we are doing at the moment. So having said that, now we come to the process of how we are going to utilize the resources by doing the necessary collaboration with education and other relevant parties. So again, I am going to share, this is the list of the words used by this idea and other act in the vocabulary we are using, and this is the process that they are using in the idea act for you to do the job, and it's detailed, but this is just the summary of the process. And when you bring the principles of management, the parental training and educational accommodation, the most important thing is to safeguard the self-esteem of the child. And then if there are medications, so that is how we work always with drugs. So this is what Safiro is bringing his expertise. And the legal framework in the UK, the special education needs framework, and also we will be able to learn some good practices from that. And then recently they brought a concept that no child is left behind. I think over last 20 years there are 5 themes have changed. The recent theme is no child left behind, and there is a process of evolution. Initially, it was called the Handicapped Children's Act, and ultimately those words are now dropped over last 40 years, and now we have a more appropriate good words. So RTI model, I told you. And you can see RTI model, the UK and USA, both the GPs are brought in to do that. This involvement, and you can see in 2001 in this UK Act, the Education, Health and Care, you call the ECH tool, is the GP has been integrated into the multidisciplinary team along with the educators, psychologists, and the pediatricians. So therefore, the evidence is that 2 decades ago, our role had been defined legally in the UK and USA systems. So resource mobilization, the last part of my lecture actually in this 5 process. Resource mobilization, we have to direct them to information assistance funding resources and parent training and information resources. These are certain things which are listed on the IDEA Act. And then the community parent resource centers, rehabilitation services and administration. And these are things. And so I think it is very important and to be a competent physician on this regard that the child is, we have to understand the child is unique with various potential and weaknesses, and it's your duty in this 5-step process that the health education authoritative, legal and social aspect is covered and send an special. So these are the, I told, evolution of the IDEA Act. Specific learning disorders, I will just show you in 2 minutes that dyslexia and dysgraphia, dyscalculia, its neurodevelopmental concern is being brought. As I told you, the neural connections are in place and various aspects of the brain is handling various activities. So, and it's fairly common. Dyslexia people, this is 10% of the population have strong dyslexia in 1 in 10. Usually, if you see the dyslexia websites, they talk about 20%, 1 in 5 actually. Dyscalculia 5 to 7%, and dysgraphia 5 to 20%. So these can be mixed up together as well. So roughly about 1 in 5 kids are having some kind of specific learning disorders. So, and you have categories of, you can see the subtypes of dyslexia, and then how the brain is functioning with regard to dyslexia, and then dysgraphia also the same, various parts of the brain are in function. And then these are the early detection signs of dyslexia, dysgraphia, and dyscalculia, various elements, how you are going to touch. And then dyscalculia also the same, these are the early detection signs of dyscalculia. So dysgraphia, various tools are being used to see the dyscalculia and all these specific learning disorders. These are some tools we use depending on the age of the child. And take-home messages, of course, what I have to tell is, I think you all would have got some idea about what this learning academic underachievement is. That definition is also partly evolving, And it is not a problem of low achievers. Actually, it's a uniform thing. High achievers, middle achievers, low achiever, all are having this issue. So therefore, and it has impact not only individuals as well as the society in all aspects up to the economy. And it's our duty to learn to care academic underachievement, first to detect and then to verify, then how we are going to see the courses, medical, then family and the social and other courses, then how we are going to do a proper diagnosis, then how we are going to be a part of the team to develop a plan to collaborate with the others, and then how we are going to direct parents for appropriate activities is all you need to learn. So Daru, you can see if a child can't learn the way we teach, maybe that we should learn to teach how they can learn. And you can see it is very important, the take home message, that don't destroy the self-esteem of a child. That is the crucial piece of that I want you to take is as the take home message. And if you do, if you damage their self-esteem, that will be a real troublemaker for you for life. So if you guard their self-esteem and according to their potential, if you direct them for some kind of productive activity, or at least to safeguard themselves for the daily activities of their living, then of course we have saved individual as well as the society. It's very important. So every child has a different learning style and pace. Each child is unique. It's only capable of learning, but also capable of succeeding. Thank you very much. I think this is, I would have touched very superficially with regard to the academic underachievement, maybe a novel topic for you. And in this lecture scope is covering only the basic superficial idea, and we have to go into the detailed lectures to understand each step, and then the specific learning disorders and how we are going to develop our SOPs and what are the things that we are going to learn. Thank you very much for kind and very patient listening, and I hope that you have got some concerns with regard to this topic.
Thank you very much for your excellent lecture, sir. So we have a few questions from the participants which were submitted previously before the lecture. You have answered most of their questions during the lecture. So one question is that at what age to be start the educational assessment?
Can I go ahead and answer? Yeah. Yeah. What age is in the sense, that's why the development milestones start from the very beginning. That as the family physician and the family pediatrician, we have to monitor their activities, and then you have the preschool. Actually, education is, yeah, you are talking about the school education. I think education has not only confined to the school education. You have school education and other education. So education is a very broad topic. So therefore, it starts from the very beginning. To be honest, it will start from before birth, because we are going into the family background. Their kind of whether they have education difficulties in their families. From that point onwards, as a doctor, we monitor right up to their career and when they are adults.
Next question is, can you directly send the children to LRH? What's the referral pathway?
Actually, to be honest, for last more than a decade, I have been running this clinic, but I haven't given any publicity for reasons, because we have very limited resources at the moment in LRH. We can cover only because it takes time, and only maximum of 12 patients per. That is also actually our team says only 8 patients per day, but 12 patients, because it takes about 45 minutes, depending on the child's contribution, it takes time. So we have a long waiting list, despite that 3-4 people are doing in one go. So children are coming to our clinic and we are doing that job. I think it is, rather than my doing, it is our duty that most of the pediatricians take this aspect over, and especially the pediatric neurologists can take this aspect, and we have to disseminate the abilities or competencies right all over the country.
Next question is there a guideline or training program for medical officers who are interested in helping children?
Currently, of course, we have to develop such thing. And to be honest, we don't have such system, I think. And another important thing is we work in silos. You can see what number of collaborations had to be brought in for the best interest of the child. Even now the psychologists, and there are different types of psychologists. When we are going to bring everybody together, there will be issues with regard to their egos, their territories, all these things. That is why this IDEA Act and Special Education Act, SEN Act, Special Needs Act of UK, they are trying to put some procedural SOPs and legalizing, bringing authoritative aspect into it. Then, of course, based on that, you have to train them to deal with each and every tool and to cover their territories appropriately. So this is a very complex task that I think we all will have to sit together and develop. That's all.
Thank you again, sir.
Thank you very
So
much.
our
And I hope you all understood the basic concept behind this thing, and there is a large scope for us to touch upon in time to come. And especially the registrars and younger than that who listen to this lecture will have to look forward to do a proper job on developing these resources to this country for the best interest of all of us, because now the growth rate has also gone down. Every child is more and more precious at the moment, that it's our duty that we look after them. Similarly, if this part of the world, apart from USA and UK, they don't have good SOPs. So if you develop that kind of a model, we can be center of excellence and a teaching model for others to follow how we deal with academic underachievement. And that will be really rewarding, really rewarding. And people are really appreciating when you do a cataract operation. This is actually like that we are giving light to the child's real potential and what they are struggling, and then we are guiding them to come out of their current kind of concern or claim. It's very important. So
okay,
thank you very
thank
much.
you for your excellent lecture, sir. Dear
Thank you.
participants, please find the link in the chat box and kindly give your feedback and answer the post-assessment questions to receive your e-certificate. Let's wind up the session for today. Thank you.